Question 32, which of the following is the most appropriate next step in management to address his highest risk potential complication? Okay, so this is a long stem here. I actually zoned out reading this before I started recording. So our answer choices are something about stroke, MRA, prednisone, nephrectomy, probably something renal based off of these. 40-year-old man presents for evaluation of worsening hypertension and intermittent headaches. Okay, so we know it's renal, so hypertension makes sense in that context. Maybe headaches make sense. Maybe that's just the hypertension though. Hypertension can cause headaches. He's noticed increasing fatigue and occasional flank discomfort over the past several months. Okay, something to do with the kidneys. Father died suddenly at age 49. Okay, they never just say that. That is almost always important. Paternal uncle required a kidney transplant. Okay, so they're definitely hinting at something genetic. And it's fairly young too, 49 and 50s. On physical exam, his blood pressure is 162 over 100, pretty good score. Bilateral abdominal masses are palpated on deep exam. Serum creatinine elevated. UA shows hematuria, no proteinuria. Fundoscopic exam is normal. So we've got kidney problems with a genetic correlation, and people died suddenly. They died suddenly, right? It's not like a slow uremia death. Something suddenly happened. And let's take everything into consideration here. We have kidney problems, deep palpation reveals abdominal masses bilaterally, and headaches. Okay. If you're thinking PKD, polycystic kidney disease, you win. Now, again, kind of a red herring. Hypertension can cause headaches on its own. But headaches could also be from saccular aneurysms from PKD. So you never know. We don't know for sure what's causing it here, but we know we've got this crazy genetic link with kidney masses in this 40-year-old man. Before we even read the answer choices again, since this is a long question, I just want to reread it again just to make sure I know exactly what I'm being asked. I often, on real test questions, I often read the question part at least twice if it's a longer question like this, and especially when doing level or step 2 questions. Those tend to be intentionally tricky. Next best step is not always next definitive step or most definitive step. So which of the following is the most appropriate next step in management to address his highest risk potential complication? So highest risk complication from PKD would be a Barry aneurysm. So we need to find something that's related to the brain. Aspirin therapy for stroke prevention. Okay, that makes sense, right? We don't want him to have a stroke. If that Barry aneurysm ruptured, then he could have a stroke. But let's think about that. So the problem is possible Barry aneurysm in one of the cerebral vessels in his brain. Aspirin is an antiplatelet drug that, as we tell our patients, it quote unquote thins the blood. What that really means is it prevents blood clots from forming. The problem with this guy is not forming blood clots. It's having really high blood pressure with this thin-walled aneurysm. Put those two together, and eventually this is going to burst open. So again, aspirin is going to prevent clot formation, not prevent high blood pressure and bleeding. It would actually worsen bleeding. So aspirin is not the correct answer here. Schedule screening, magnetic resonance angiography. So this is MRA is just like MRI, but to look at blood vessels. So this potentially could be it. This could help you look at the cerebral vasculature and see if he has any Barry aneurysms. So this one is probably it, but I'm going to keep going. High dose prednisone to limit inflammation. This is just not an inflammatory process like that. You got nothing to do with PKD. Refer for elective nephrectomy. So we're going to take out his kidney or kidneys. Go back to the question. We're doing the next best step to reduce his highest risk potential complication. Like, unless you consider being alive a complication, this doesn't make sense. Perform urgent renal biopsy to confirm diagnosis. Okay, so that one doesn't sound inherently wrong, right? We could do a biopsy to confirm the diagnosis, and maybe they will anyways. But does that answer the question? The next step in management to address his highest risk potential complication. This is diagnostic, not addressing the highest risk complication. So it's not it. Correct answer is B, MRA, because we need to find any Barry aneurysms, because that's the complication we're worried about.